Hello, my name is Benjamin Newman. I'm a fourth-year pharmacy student on rotation at the Athabasca Healthcare Center, and today I've been asked to talk about a pharmacy student's guide to type 2 diabetes medications for nurses. So let's get started. So this is just my brief outline here. I'm going to talk about type 2 diabetes as a refresher, just to get everybody on the same page. And then I will go and break down some of the more common medications that we see in practice today. So just a quick refresher on type 2 diabetes. Type 2 diabetes is a late onset disease, meaning we most commonly see it in people 50 years of age and older. Like type 1 diabetes, type 2 diabetes is progressive in nature, meaning that the longer someone has it, the more that disease will progress and get worse. Type 2 diabetes is characterized by a person's cells being or gaining resistance to insulin, meaning that insulin does not work as well as it would if that person didn't have diabetes. This is in contrast to someone with type 1 diabetes, which is often characterized by a person's inability to produce their own insulin. People with type 2 diabetes, for the most part, can still produce their own insulin, just their cells don't respond to it as efficiently as they used to. The main risk factor for type 2 diabetes is poor lifestyle. So things like smoking, poor diet, overweight, all those things can contribute to increased risk for type 2 diabetes. Additionally, with diabetes, it's also important to talk about A1C. A1C is our lab measurement that gives us an idea of how well controlled a person's blood sugars are over the last 3 months. And it's 3 months because it looks at the lifespan of red blood cells, which is 3 months. Now, A1C targets can vary person to person. In a healthy person who does not have diabetes, generally their A1C would be less than 6. In someone with type 2 diabetes who is relatively young and healthy without any major other health complications, the general target is an A1C of less than 7. And this is just because diabetes can have many complications later in life, including kidney issues, nerve damage, all that stuff that can happen when a person's blood sugars are elevated for too long. Now, in people who are older or have more complex chronic medical health conditions, we can be a little bit more lax with A1C and then can aim for somewhere between 7 and 8.5, depending on their health status, because in this population of patients, we worry about hypoglycemia, which also comes with its own risks. So that's kind of a quick refresher on diabetes. We'll now jump into the medications. So the first medication and the most common and popular one you will see in practice is metformin. Metformin really is the workhorse of type 2 diabetes management. It acts by increasing the responsiveness of a person's cells to insulin, thereby kind of acting to make kind of normalize that response to insulin. Generally, metformin is the first medication that's started when someone is diagnosed with diabetes, and it is best taken with food or meals, as this helps increase the amount of active drug available to act on the cells. One of the most common side effects or adverse reactions with metformin, especially at first, is that it can cause some stomach upset. Aside from diabetes, metformin also has other uses. One cool use for metformin is that it can be used to improve fertility and the menstrual pattern in women with polycystic ovarian syndrome. Additionally, metformin has also been used in the treatment of medication-induced weight gain and insulin resistance, something that we commonly see in people who have been using certain types of antipsychotics for years. The next class of medications for diabetes that I wanted to talk about are the secretagogues. Now, unlike some of the later medications we're going to talk about, these ones don't nicely fit into their own naming category. So you might just have to remember these. I've picked the three kind of most popular ones you would be likely to see in practice, and these include gliclazide, glyburide, and repaglinide. Unlike metformin, the secretagogues act by increasing the secretion of insulin, and that's how they get their names, secretagogues. Now, like metformin, the secretagogues should be taken with meals, but this is because they can actually cause low blood sugars if they're not taken with meals. So, unlike metformin, secretagogues can cause hypoglycemia. Additionally, they also have the side effect of some weight gain as well. Generally, in terms of the hypoglycemia risk, the older secretagogues are worse for this than the newer ones. So we'd be looking at glyburide having the greatest risk, and gliclazide having the lowest risk. Moving on from there, I wanted to talk briefly about the DPP4 inhibitors, or the gliptins. The most common ones seen in practice being sitagliptin, saxagliptin, and linagliptin. Now, these medications act to stimulate glucose-dependent insulin release. So, in other words, when a person's blood sugars are elevated, the medication will stimulate insulin release and kind of act to produce more insulin, so you have more of a response in people with diabetes. Now, DPP4 inhibitors are rarely used on their own and often used in combination with metformin. In fact, in the community, DPP4 inhibitors exist as combo pills with metformin, thereby giving prescribers and pharmacists the ability to prescribe medications that will help reduce the A1C while also not increasing medication burden for patients. Like I said, limited efficacy by themselves, but generally the gliptins are quite well tolerated. The main note here is that saxagliptin should be avoided in heart failure because it can cause worsening of that condition. The next class of medications are the GLP-1 agonists, or the glutides. The main ones being semaglutide and liraglutide, among others. Like the gliptins, the glutides act by stimulating glucose-dependent insulin release. Unlike the gliptins, for the most part, the glutides exist only as injectables. That is, until recently. Semaglutide, known by its brand name Ozempic for the injectable, now also exists in an oral form as of the last couple of years called Rybelsus. With these medications, they do have the benefit of having either daily or weekly options available for people who might be interested in that sort of thing. Of course, you have to balance that out, as not everybody would like an injectable. One note with these medications, whether oral or injectable, is that titration is required because these medications are known to cause quite a bit of stomach upset if we were just to start off with the target dose. One of the major benefits of the glutides as compared to some of the other medications is that there is actually the benefit of weight loss with these medications. And that's actually something that they're used for aside from diabetes. Now, the dosing is different for diabetes than it would be for weight loss. That being said, people who use this medication at the diabetes dose do still notice weight loss in the area of several kilograms, even within a year. The next class of medications that I'm going to talk about are the SGLT2 inhibitors, or the flozins. Those being empagliflozin, dapagliflozin, and canagliflozin. Now, these are our newest antihyperglycemics on the market currently, and they are quite effective at what they do. Unlike some of the other mechanisms of action for some of the other medications we've already talked about. These ones are unique in that they cause the excretion of excess glucose into the urine via the kidneys. So basically, it allows a person to excrete excess glucose. Additionally, these medications have been shown through various high-quality studies to confer both protection for the heart and the kidneys, which is an added benefit if we're looking at protecting those organs as well. Now, with their mechanism of action being excreting glucose in the urine, comes the risk of increased UTIs, and this is something we often counsel patients about. Like some of the other medications, the flozins also have a use outside of diabetes. And this is something that you might see in practice, as they also play an important role in the treatment of heart failure, whether or not a person actually has diabetes. And this is due to their cardio and renal protective benefits, as well as being able to help reduce fluid in an individual. There are other medications that are used for diabetes. However, you don't often see these much in practice, but they would be pioglitazone and acarbose. The reason we don't really see them much in practice is just because they're older. They have quite a few more side effects compared to some of the newer medications, and we just prefer some of the newer, better ones. But I thought I'd list them here just in case you do end up seeing them in practice at some point. Of course, I couldn't talk about type 2 diabetes without also mentioning insulin. Now, there are a few different uses for insulin in people with type 2 diabetes. The big one being treating major hyperglycemia and correcting that quickly in patients who are experiencing things like ketoacidosis and that kind of thing. Insulins are also first line in people who are pregnant with type 2 diabetes or people looking to get pregnant. And they are also used in advanced disease for type 2 diabetes because, of course, diabetes is progressive and sometimes we have no other options. There are several different kinds of insulins available. I'll just briefly talk about two of the more common ones you'll see in practice. You have the long-acting insulins, which basically act to mimic a normal healthy person's basal insulin that they produce as a baseline throughout the day. Some common brands that you might see in practice include Lantus or Basaglar. And then we also have the rapid-acting insulin, which mimics bolus insulin that would be released after meals or when someone consumes food. Some of the popular brands include Humalog, Admelog, and NovaRapid. There are others, but like I mentioned, these are less commonly used, so I will not talk about them here. Some of the main cons with insulin are that, of course, they're injectables and not everybody is keen on the idea of an injection. Some of the other issues with insulin is that there's obviously an inherent hypoglycemia risk with these because of the blood sugar lowering capability of them. And then insulin also can cause weight gain as well. Like some of the other medications we've talked about, insulin also has a role outside of diabetes management. And this is something you probably have seen in practice as well. Insulin can be used to quickly correct hyperkalemia in patients with high potassium. This is done because insulin helps to draw potassium into cells, thereby eliminating it from the serum. Of course, when we inject insulin into people, we also run the risk of hypoglycemia. So when this method is employed, we often administer glucose as well to kind of counteract that. So I've talked about the medications that we see in diabetes. I just wanted to briefly tie it all together with a patient case, and this is something that has been based on a case that I've seen in practice. So WS is an 82-year-old male patient. Past medical history is type 2 diabetes, hypertension, GERD, and dementia. His reason for admission was failure to cope, and some of his current medications include gliclazide, repaglinide, basaglar insulin, perindopril, and pantoprazole. Of course, on admission, the nurses also checked some of his labs. His A1C on admission was 6.8, and his blood glucose on admission was 3.2. So we can see that currently he is hypoglycemic, and that should be treated. Additionally, given his current medical conditions, his age, and his reason for admission, I would be concerned that his A1C is a little bit too low for his demographics. I would consider possibly increasing this to a less strict A1C target because at this point in time, I am worried about the risks that low blood sugars pose for this patient. So my drug-related problem would be that WS is at risk of hypoglycemia and should have his diabetes medications and A1C target reevaluated by the proper healthcare professionals. So finally, to wrap up with some take-home messages. Like we talked about, diabetes is a progressive condition, which gets worse the longer someone has it. Thankfully, there are many medication options for the treatment of diabetes. So over the course of someone's life with diabetes, they will often see many different medications employed. Now, that being said, just because someone is on diabetes medications, as we already talked about, it does not mean we are treating diabetes or they're using it for diabetes. There are other uses for these diabetes medications. And of course, hypoglycemia is a risk even with certain oral medications. Oftentimes, we focus so much on the hypoglycemia risk of insulin that we fail to stop and think about some of the medications that people might be on. So I hope this talk was informative for everybody listening, and I just wanted to extend a thank you for taking the time to listen, and I hope you learned something. Thanks so much.